Hi, it's Christina with the Sisyphean Journal. Today is April 13th, and I have already covered today's death, which was one of actually the middle of 5 deaths attributed to Dr. Louise Achtenberg in early 20th century Chicago. Again, these deaths had nothing to do with lack of antibiotics. It was purely because the legalization fairy hadn't sprinkled her magic safety dust. Antibiotics would have mysteriously appeared out of nowhere if the legalization fairy had been freed. But enough sarcasm. Again, Planned Parenthood is facing some criticism and also possible defunding, so I thought I would take a look at a lawsuit on the Abortion Doc's website, which centers around adequate informed consent. So a woman named Celina sued Planned Parenthood League of Massachusetts, Dr. Tara Kumaraswamy, and a nurse for emotional trauma and lack of informed consent. Now, both Planned Parenthood and Celina agree that she went to the Planned Parenthood in Worcester, Massachusetts on March 12, 2015 for the first part of a 2-day abortion procedure. Celina asserts she was never warned that she might expel an intact, recognizable fetus. She said that the day after the laminaria were inserted, she called to report severe pain as if she was in labor, but she was told to take her prescribed pain meds and wasn't told to seek further care, nor was she warned that she might expel a recognizable fetus. And that night, she delivered a 16-week fetus in her bathroom and suffered, quote, physical pain and severe emotional and mental trauma as a result. The suit doesn't specify if the baby came out alive or dead. Now, Dr. Kumaraswamy agreed that she did insert the dilators for Celina's abortion, but denies any lack of informed consent. Now, I have been unable to find any copies of a standard Planned Parenthood D&D consent form online, but I did ask Grok if expulsion of an intact, recognizable fetus is one of the risks covered by Planned Parenthood in their informed consent. And I got the following answer. For the Planned Parenthood League of Massachusetts, PPLM, the informed consent process for a dilation and evacuation D&E procedure does not explicitly warn patients that they might expel an intact, recognizable fetus as standard part of the consent discussion. This aligns with the broader practices of Planned Parenthood affiliates, where the focus is on medical risk and procedural details rather than specific outcomes like the appearance of fetal tissue unless directly relevant to a listed complication. PPLM's approach to informed consent for D&E based on their general patient care model and available documentation emphasizes 1. Procedure overview. Patients are told that cervical dilation using osmotic dilators like laminaria or misoprostol prepares the cervix for evacuation with suctioned-in instruments, typically in the second trimester. The goal is to remove pregnancy tissue, not to deliver an intact fetus. Complications. They inform patients about the risks like bleeding, infection, cervical injury, uterine perforation, and incomplete abortion, as these are the most common and medically significant concerns. For example, excessive bleeding or incomplete dilation might require an additional intervention, but spontaneous expulsion of an intact fetus isn't framed as a typical risk. Patient experience. They cover what to expect, e.g. cramping, sedation options, and post-procedure care, but the consent process avoids graphic descriptions of fetal tissue unless a patient asks specific questions. No public PPLM-specific consent form for D&E explicitly mentions the possibility of expelling an intact, recognizable fetus. This is consistent with the procedure's design. D&E involves removing tissue in fragments, unlike induction abortions where intact expulsion is most likely and might be discussed. However, in rare cases, such as if osmotic dilators or misoprostol trigger unexpected contractions before the evacuation step, an unintended expulsion could occur. PPLM doesn't highlight this in standard consent materials, likely because it's not a common outcome and isn't a procedural goal. Massachusetts law requires parental consent or judicial bypass for minors seeking abortions, but doesn't mandate specific warnings about fetal appearance. PPLM's counseling, often paired with their judicial bypass notification program, focuses on ensuring informed choice and emotional support rather than mandating such a disclosure. Their website and patient resources describe D&E as a safe routine procedure without mentioning intact expulsion as a risk. So I have a really hard time that Celina was warned that she might see her dead baby. So let's look at Dr. Kumaraswamy's description of unfolding events. She did describe placing dilators and spends a lot of time stating that Celina was provided with a 13-page consent form warning her of the possible complications, among other things. Celina was then discharged and told to return the following day to have the procedure. There is no mention that the baby was injected with digoxin, which would be almost unheard of at 16 weeks anyway, which increases the likelihood that the baby was still alive when Celina delivered it at home. According to Kumaraswamy, Celina called around 4:25 in the evening, that's the same day the laminaria were inserted, to report 10 out of 10 pelvic pain reduced to 7 out of 10 with 1 tab of Percocet. Records indicate she was advised by nursing staff to take another tab of Percocet to rest at home, to call the on-call nurse if symptoms worsened overnight, and to go to the emergency room if necessary before her scheduled appointment the next morning. Kumaraswamy went on to say that she got a call from the hospital around 9:30 the following morning that Celina had passed the pregnancy at home. And that is how the doctor put it, passed the pregnancy, the pregnancy, the pregnancy. She was not traumatized by a pregnancy. She was traumatized by the sight of her dead baby. Was receiving treatment for a retained placenta. So again, was the informed consent adequate? The doctor again asserts that Celina was given adequate informed consent by saying, the 13-page consent form adequately describes the risks of the procedure, including potential injuries and complications such as bleeding and leaking of fluid. The consent form is regularly reviewed and updated by the National Planned Parenthood organization. The proper Massachusetts state-required mid-trimester abortion consent was also signed by the patient prior to her procedure. Now, I would consider expelling a recognizable 16-week fetus to be a very different experience from bleeding and leaking of fluid. And if you look at the photo of a 16-week fetus, would you describe that as leaking of fluid, okay? And just Google 16-week fetus, arms, legs, fingers, toes, recognizable eyes, ears, nose, lips. I would not describe that as leaking of fluid. It seems that if the consent form included the possibility of expelling an intact, recognizable fetus, Kumaraswamy would have mentioned it in that letter defending herself. And there is also nothing in Massachusetts law requiring warning an abortion patient of the possibility of expelling an intact, recognizable fetus. Now, the doctor's letter defending herself includes her entire 9-page curriculum vitae, but it does not include any of the consent documents that supposedly warned Celina, gave her sufficient warning that she knew she might expel her dead baby at home and see a dead baby, recognizable baby. Anybody who looks at this picture is going to say, yep, looks like a baby to me. You tell me, do you think telling her she might expel fluid, leak fluid, some blood in fluid, the pregnancy, do you really think that's going to prepare you for delivering your dead 16-week baby and seeing it at home?